a look at a rare disease. What is granulomatosis with polyangiitis? Imagine your body's own defense system designed to protect you turning against you. This is not just a simple malfunction but a complex and often devastating condition. This is the unfortunate reality for individuals with granulomatosis with polyangiitis, previously known as Wegener's granulomatosis. It is a condition that can affect anyone, regardless of age or background, though it is more commonly diagnosed in middle-aged adults. GPA is a rare autoimmune disease that affects blood vessels, primarily in the nose, sinuses, lungs, and kidneys. These areas are particularly vulnerable because they are rich in small blood vessels, which are the primary targets of the disease. In GPA, the immune system mistakenly attacks healthy tissues, causing inflammation and damage. This misguided attack can lead to a range of symptoms, from mild to severe, depending on the organs involved. This inflammation leads to the formation of granulomas, which are clusters of inflammatory cells. These granulomas are not just a sign of the disease, but also a cause of further complications. These granulomas can obstruct blood flow and impair organ function. When blood flow is restricted, it can lead to tissue damage and organ failure, making early detection and treatment crucial. GPA is a serious condition that requires prompt diagnosis and treatment to prevent long-term complications. Delays in treatment can result in irreversible damage to vital organs, significantly impacting the quality of life. With proper medical care, individuals with GPA can manage their symptoms and live fulfilling lives. Treatment often involves medications to suppress the immune system and reduce inflammation, as well as regular monitoring to catch any signs of disease progression early. Understanding GPA, its causes, symptoms, and treatment options is crucial for both patients and healthcare providers to effectively manage this complex disease. Education and awareness can empower patients to take an active role in their care, leading to better outcomes and improved quality of life. Unmasking the culprit. What causes GPA? The exact cause of GPA remains a mystery, but researchers believe that a combination of genetic predisposition and environmental triggers plays a role. Genetic factors are thought to create a foundation of susceptibility, making some individuals more prone to developing the condition. This genetic predisposition is often inherited, passed down through generations, and can be identified through specific markers in the DNA. While anyone can develop GPA, it is more common in individuals of European descent. This higher prevalence in certain populations suggests that genetic factors play a significant role. Studies have shown that people of European ancestry are more likely to carry the genetic markers associated with GPA, although the reasons for this are still being investigated. Some potential environmental triggers that have been linked to GPA include infections, such as those caused by bacteria or viruses, and exposure to certain chemicals or dusts. These environmental factors can act as catalysts, triggering the onset of GPA in genetically susceptible individuals. For instance, respiratory infections have been frequently noted as a common precursor to the disease. However, it's important to note that not everyone exposed to these triggers will develop GPA. This indicates that while environmental factors are significant, they are not the sole cause. The interplay between genetics and environment is complex and not fully understood. Research suggests that in individuals with a genetic susceptibility to GPA, exposure to certain environmental triggers may activate the immune system inappropriately, leading to the development of the disease. This inappropriate activation can cause the immune system to attack the body's own tissues, resulting in the inflammation and damage characteristic of GPA. However, more research is needed to fully understand the complex interplay between genetics and the environment in GPA. Scientists are continually working to uncover the specific mechanisms that lead to the disease, with the hope of developing more effective treatments and, ultimately, a cure. Understanding these mechanisms is crucial for advancing our knowledge and improving patient outcomes. Deciphering the signals, symptoms of GPA. GPA can manifest with a wide range of symptoms, making it a challenging disease to diagnose. The symptoms often develop gradually and can mimic other conditions, leading to delays in diagnosis. Common early symptoms of GPA include persistent stuffy nose, nosebleeds, sinus infections that don't respond to antibiotics, and hearing loss. As the disease progresses, it can affect other organs such as the lungs and kidneys. Symptoms of GPA affecting the lungs may include shortness of breath, chest pain, and coughing up blood. Kidney involvement can lead to fatigue, swelling in the legs and ankles, and changes in urination. From symptoms to diagnosis. Identifying GPA. Diagnosing GPA or granulomatosis with polyangiitis involves a multifaceted approach. It starts with a thorough physical examination where the doctor looks for signs of inflammation and other symptoms. This is followed by a detailed review of the patient's medical history to identify any patterns or previous health issues that might be relevant. Your doctor will ask about your symptoms, perform a physical exam, and order blood tests to look for signs of inflammation and specific antibodies associated with GPA. These blood tests are crucial as they help in identifying markers that are often present in patients with GPA, such as ANCA, anti-neutrophil cytoplasmic antibodies. Imaging tests, such as X-rays, Connecticut scans, or MRIs, may be used to visualize the affected organs and assess the extent of the disease. These imaging techniques provide detailed pictures of the organs and tissues, helping doctors to see the areas of inflammation and damage caused by GPA. In some cases, a biopsy of the affected tissue may be necessary to confirm the diagnosis. This involves taking a small sample of tissue from the affected area, which is then examined in a laboratory. A biopsy involves taking a small sample of tissue and examining it under a microscope for granulomas and other characteristic features of GPA. This microscopic examination is essential for identifying the specific cellular changes that are indicative of GPA. Early diagnosis and treatment are crucial for improving outcomes in GPA. Prompt medical intervention can help manage symptoms, prevent complications, and improve the quality of life for those affected by this condition. Regular follow-ups and monitoring are also important to ensure the disease is kept under control. Section 5. Navigating the treatment landscape for GPA. Treatment for GPA typically involves a combination of medications to suppress the immune system and control inflammation. Corticosteroids, such as prednisone, are often used to rapidly reduce inflammation and control symptoms. Immunosuppressants, such as cyclophosphamide, methotrexate, or rituximab, are also used to suppress the immune system and prevent further damage to the body. These medications can have serious side effects, so close monitoring by a healthcare professional is essential. In addition to medications, lifestyle modifications such as quitting smoking and maintaining a healthy weight can help manage GPA and improve overall health. Section 6. Living with GPA, Prognosis and Long-Term Outlook. With early diagnosis and appropriate treatment, the long-term outlook for individuals with GPA is generally good. However, GPA is a chronic disease that requires lifelong management. Even with treatment, relapses can occur, so it's important to be aware of the symptoms and seek medical attention promptly if they reappear. Regular follow-up appointments with your healthcare team are essential to monitor disease activity and adjust treatment as needed. Section 7. The importance of early detection and intervention. Early detection and treatment are paramount in managing GPA effectively. When diagnosed and treated promptly, the disease's progression can be slowed or even halted, significantly improving the long-term prognosis. Delays in diagnosis can lead to irreversible organ damage and increase the risk of complications. Therefore, it is crucial to consult a healthcare professional if you experience any persistent or unusual symptoms, especially those related to the nose, sinuses, lungs, or kidneys. Timely intervention can make a significant difference in the lives of individuals with GPA, allowing them to manage their condition and maintain a good quality of life. Section 8. Ongoing research and future directions. Scientists are continually working to improve the understanding, diagnosis, and treatment of GPA. Research is ongoing to identify the exact causes of GPA, develop more targeted and effective therapies with fewer side effects, and improve the long-term outcomes for individuals with this challenging disease. Promising areas of research include the development of new biomarkers for earlier diagnosis, novel immunosuppressive medications with improved safety profiles, and stem cell therapies to regenerate damaged tissues. Section 9. Seeking support and resources for GPA. Living with a rare and complex disease like GPA can be challenging, but there are resources available to help individuals navigate the journey. Support groups and online communities can provide a platform for connecting with others who understand the challenges of living with GPA. These platforms offer opportunities to share experiences, exchange information, and find emotional support. Additionally, organizations such as the Vasculitis Foundation provide valuable resources including educational materials, financial assistance programs, and connections to healthcare professionals specializing in GPA.